intervention to reduce MDRO transmission. And like Jill said, it involves our staff wearing gown and gloves. So what is an MDRO? Because this is a word you're going to hear a lot now. An MDRO is a multi-drug resistant organism. And so a multi-drug resistant organism is a bug that you have in your spit or your urine or your blood or your wound that is not susceptible to medication like it used to be. So a resident with a simple E. coli UTI now turns into an E. coli ESBL UTI, where that bug has grown and changed because germs want to survive just like everything else. So they change their ways to do that. And what they do then is they become resistant to all of the antibiotics we've used for years to kill the bug. They're also referred to like as superbugs. And so what they've found is that they said about roughly 50% in our area. I don't know that I agree with that number, but they're saying about 50% of residents in nursing homes have had or have one of these multi-drug resistant organisms. So the goal of enhanced barrier precautions is to help reduce the transmission of multi-drug resistant organisms. And what they're doing is, by you going to take care of Heidi and wearing a gown and gloves, the multi-drug resistant organism is just gonna touch Heidi's gown and not Heidi's clothes. So then, or the person taking care of Heidi's clothes. So then when that person goes to take care of Jill, they'll be in a different gown and gloves, and that way her clothes are not coming in contact with that person's environment also. So they define high contact resident care activities. So we've talked through a lot of these. We've tried to make them make the most sense we can. I do agree that some of them just seem kind of silly. But high contact resident care activities include dressing, bathing or showering, transferring, and there's a few things that go with transferring we'll talk about later. Providing hygiene, which involves brushing hair, brushing teeth, helping wash your face, putting in and out of dentures, all that kind of stuff. Incontinence care and toileting, changing the residents' linens, any device use or care, and when they talk about a device, they're talking about a feeding tube, a central line, an IV, Foley catheter, things of that nature.
Is that on your next slide? Sarah?
Yep. And then also wound care. So anytime you're doing wound care, you'll have to wear a gown and gloves. And then personal protective equipment. With COVID, we all kind of understand what that is, but it's just meaning that we're going to be wearing gowns and gloves more often. Okay, so kind of like I said, enhanced barrier precautions are an infection control intervention meant to reduce transmission of multi-drug resistant organisms. And like we said, we're trying to reduce the transfer from resident to resident, or a resident that has an indwelling medical device or a wound is going to be at higher risk of contracting an MDRO. So in some ways, it's protecting them from potentially getting one of these superbugs. All right, so what's the difference between enhanced barrier precautions and everything else we already do? So the biggest thing is enhanced barrier precautions are only when you're doing these certain activities with a resident. If someone is on contact precautions, that's for everything you do in their environment. So from the minute you walk in their door, you're gonna have a gown and gloves on. The difference with enhanced barrier precautions is I'm only gonna put that gown on if I'm doing certain things. If I'm gonna walk into a resident's room on enhanced barrier precautions to get them more water or just answer the call light, I don't have to put a gown on. Or if I'm the nurse dropping off their oral medication, doesn't require a gown. You can drop off a lunch tray. Social services can go in and interview them or talk to them without having to wear a gown and gloves. Whereas with contact precautions, you're gonna be in a gown and gloves no matter what you do because you're in their space. And then standard precautions is what we're already doing. We're wearing gloves for pericare. We're wearing gloves to check blood glucose, those kind of things. Anytime we think we might come in contact with bodily fluids. So which residents need enhanced barrier precautions? So at first it was a lot, and thankfully CDC has kind of adjusted their viewpoint. So any resident that has a chronic wound, an open pressure area, a diabetic ulcer, an unhealed surgical wound, or an arterial or venous stasis ulcer is going to require enhanced barrier precautions. This doesn't count like someone was walking down the hallway and got a skin tear on their arm and we just put a Band-Aid on it. Something small like that does not require enhanced barrier precautions. If that skin tear becomes a chronic area on their shin because they have poor circulation, then that may transfer to where we consider that a chronic wound and we want to use gowns and gloves. And then any residents with an indwelling medical device. So a central line, such as a PICC line, an access mediport, a dialysis catheter, a urinary catheter, a feeding tube, or a trach. They do not count ostomies into this situation. So our current count is about 15 residents. When I recounted today, I think it's about 16 or 17. And this is gonna change depending on new admissions and different things that happen. And we'll explain a little bit more of that. Okay, so what are the high contact resident care activities we need PPE for? Dressing, bathing and showering, including in the central tub room. Transferring, and this is where the caveat is for transferring. Transferring, including in the therapy gym. But, say I bring Paul to the dining room in his wheelchair and he wants to sit in a regular chair. I can stand him up and transfer him for someone on enhanced barrier precautions without having to put a gown and gloves on. Because this is still their home and we want it to be a home-like environment as much as possible. And we don't want staff in our dining rooms and activity rooms putting gowns and gloves on and off and ruining that home-like environment. The reason they include the therapy gym is because the physical and occupational therapists are gonna have more contact in a period of time with those residents than we would in just a brief transfer in the hallway. And the other, CMS's idea is that we bundle our care a lot of times. So if you're getting someone up for AM care or putting someone to bed, you're gonna do a lot of these activities at one time. There's gonna be some random one-offs, and use your judgment is what we're gonna go with. So for providing hygiene, where it says brushing teeth, combing hair, and shaving, if you're doing that as a part of their AM and HS care, you're already probably gonna have the gown on. So yes, please do that. If it's the one-off where someone just wants to brush their teeth after lunch, as long as you're not doing a ton of these other activities at the same time, wear gloves. We don't necessarily need to go ahead and put a gown on. If you're changing the residents' linens on their bed, you would need to wear a gown and gloves. Any incontinence care and toileting. And then for device care and use, the other clarification that we made here is that if I'm going in to hook up someone to their tube feed as a nurse, there's a good chance I'm not gonna be laying on top of their bed with them or touching all kinds of stuff. So a gown or gloves only would be appropriate in that situation. Same thing with like a PICC line. If you're just going in to flush someone's PICC line or to hook them up to an IV antibiotic, gloves only would be appropriate in that situation because you're not gonna have that increased contact with them or their environment. And then wound care. I know I've talked with Janelle and Angela and we've kind of made a plan to put extra gowns in our treatment carts so that way they're available. And we'll talk a little bit more what that is gonna look like here at Welcome in just a minute. So how do we know who needs enhanced barrier precautions and how long are they gonna need it? So enhanced barrier precautions are gonna be in place until someone's wound heals, their indwelling medical device is discontinued, or unfortunately, if they're colonized with a multi-drug resistant organism, they're gonna be in place for their entire stay here at the facility. We currently do not have any residents who are colonized with a multi-drug resistant organism. If that were to change, we would let people know. And just to clarify, for someone who's colonized with an organism, it means that that organism is always in your body. If we were to go check your sputum or do a urine sample, it's gonna always show that this is in there. It just means that it's not necessarily causing an infection at the time. It could flare up and cause an active infection if you were to end up running like a fever or had increased wound drainage or something to that effect. It just means that it's always there, it's just not always active. So the way we're gonna alert our staff here at Welcome is we will have a yellow piece of paper and a magnetic sign on people's door frames. And that's gonna let you know who is on enhanced barrier precautions. We're gonna just also put on on those sheets of paper A or B, so you know which side of the room it's on. We may have some rooms where both residents are on enhanced barrier precautions. It just really depends. But we'll also keep a list at the nurses' stations and in the supervisor office of the current residents. The things that you guys are gonna have to keep an eye out for and be mindful of is if we get a new admission who has a wound or indwelling medical device, or if one of our residents develops a wound or needs a catheter or something like that put in, that's gonna be a trigger that we need to start using these precautions on those people. So the next thing is, I tried to break this down and how is it gonna impact you as a worker? What is it for your job role? How is this gonna impact us? For STNAs and nurses, unfortunately, it's gonna impact us the most because we do the most direct care on a daily basis. Just make sure you're referring to that high contact care activity list, which we'll also make sure we have posted for everyone, so in case you forget. Again, if you transfer a resident in the atrium or a common area, you don't have to gown and glove, as long as it's just gonna be a brief transfer. And then nurses may only wear gloves for PICC line meds and flushes, and same for tube feed meds and flushes. Housekeeping and maintenance will only require a gown and gloves if you're changing the linen on a resident's bed. So if housekeeping is help doing someone who's discharged, or if maintenance is working on a bed and needs to take the linen off for a resident that's on EBP. Outside of that, there isn't going to be much change. Laundry, you can use the standard process for laundry. We don't need to like take someone on enhanced barrier precautions and set their laundry aside to wash separately. It'll be washed just the regular way we're doing laundry. So for social services, same thing, unless you happen to be helping change linen or something to that effect, it really shouldn't affect you. Residents on enhanced barrier precautions don't need a private room. What we will need to do is just make sure we're communicating for new admissions who's going to require these precautions. I don't have anyone in here for therapy. I'm gonna make them their own education, but therapy, same thing. If OT is working on hygiene, they will have to gown and glove for that resident. If they're in the therapy gym doing transfers and standing and walking and things, they will also need to use the PPE. And then activities, same thing. It's just gonna be if activities is helping with any sort of ADL care or toileting on an outing, but the same thing, emphasis on a home-like environment. I don't want us out on an outing in gowns and gloves for our residents. Use your discretion. And then again, brief transfers in the atrium activities are not going to require PPE. Does anyone have any?
Residents being close together?